Okay, good morning. This is a presentation that serves as an introduction to pathophysiology. Okay, we are going to be discussing some important learning objectives which are basic to understand pathophysiology. Okay, the first learning objective that we have is to discuss the concept of pathophysiology. We are going to be talking here about several concepts which are important to start the study of diseases. For example, what is health, what is disease, what is the natural history of a disease, what are the stages of a disease. And we are going to be explaining the implications of understanding pathophysiology for diagnosis of diseases, for prognosis, for prevention, health maintenance, for selection of the therapy. Okay, we are not going to be giving specifics of what treatment we use for specific patients, but we are going to set the foundation, okay, that clinicians use to select the different diagnostic tests, therapies, screening tests, and to develop a differential diagnosis, which is essential, okay, in the practice of medicine. Okay, we are going to be talking about concepts like, as we said before, pathophysiology, but also pathology, pathogenesis, etiology, and different terms related to diseases like acute, chronic, idiopathic, diagnosis, exacerbations, complications, sequelae, signs and symptoms, and many others that have to do with some aspects of epidemiology that goes a bit beyond pathophysiology, but it's important to understand because studying the human body without studying the population, the family, the neighborhood, the environment in which people are born, live, work, etc., is impossible to understand diseases and to target give a personalized treatment, okay, to those patients and do the efforts in health maintenance and prevention of disease. So let's start by giving some definitions, okay? Let's start by talking about what is pathophysiology. Pathophysiology is a term that is related to a couple of words, pathology and physiology. Pathology, simply the study of disease, study of suffering, study of pain, while physiology is the study of nature. That is the etymological origin of the word. Okay, pathology is also a science, okay, that is dedicated to the study and diagnosis of diseases through the examination of tissues, organs, cells, and we send a biopsy. A pathologist will observe the tissue and will tell us what changes are found there. Physiology, well, we already studied physiology, so it's the study of the functions of the body under normal conditions, how the body maintains homeostasis. Pathophysiology is made by the union of these two sciences. Okay, it's the study of the abnormalities that will appear in a person when the physiology fails, when homeostasis, these mechanisms fail to maintain what we call normal conditions. Okay, so pathophysiology will be the study of the disturbances of different conditions in the body, mechanical, physical, biochemical functions, okay, that result from exposure to etiological agents, infectious agents, stressful conditions, or chronic exposures that damage the body. During pathophysiology, we are going to be studying for specific topics that are interrelated. Okay, these are the etiology of a disease, the pathogenesis of a disease, the clinical manifestations, and also what we call the natural history, how the events in a disease develop, the steps in a disease develop one after the other. And we are going to see the management implications and also the implications for screening, for health maintenance of the patients, for prevention of disease. Let's take a look at the concepts of health and disease. Health is a concept that has changed a lot, okay, in time. Okay, in ancient times, health was defined as a balance between the person and the environment. Okay, there were many people who dedicated their life to study health and disease. We can mention the Greek philosophers, for example, Hippocrates, who thought of health as a balance between the four body humors. Okay, and before these Greek philosophers, there was a more mystical concept of health and disease. Okay, all the pain, all the suffering, all the diseases were associated to punishment from the gods or simply a reward from the gods for different reasons, good or bad behavior of the persons. There was a more mystical, more spiritual view, more superstitious sometimes a view of health and disease. Now, then, after Hippocrates, we have the apportations or the works of Galen and many other physicians, okay, across time, and they were changing the concepts of health and disease, associating them every day more to aspects of the biology of the person. Okay, the modern concepts of health and disease, for example, we have several. One of them says that is a maximum, an optimal capacity of the individual for self-realization, self-fulfillment. Now is more than the absence of disease. Okay, not only refers to the health of the individuals, also as to the health of the community. For example, someone may be free of disease, but if they have someone that has a disease in their family, their health may be at risk. Okay, because maybe their work is at risk, maybe their mental health is at risk, and they may develop a disease in the future. Okay, now the WHO definition of health says that health is a complete state or a state of complete physical, mental, and social well-being more than the absence of disease. This is a very ambitious concept. Okay, and I personally don't think that there is anyone in this universe that is or has a complete physical, mental, and social well-being. Okay, so in my opinion, that definition is too ambitious, and by that definition, no one is healthy. I prefer other definitions, for example, this more holistic definition that says that health is a relative, it's not a complete, a relative state in which the person can function optimally and function well physically, emotionally, mentally, okay, spiritually, can develop, can express their identity, their feelings, okay, can develop their potentials, their talents, and express the full range of the unique potentialities within the environment in which one lives. Okay, I think that is more realistic, more applicable, okay, more reachable for any person, independently on where they live and what are the signs, symptoms, or maybe findings in the blood tests that they have. Now, let's take a look at some diagram that I created here, because we have to understand that health is not something that is a yes or no, healthy or non-healthy. It's not black and white. Okay, health and illness or disease exist in a continuum. Okay, these are dynamic processes that we may move from being more healthy or less healthy in different times of our life. Okay, and every person at any point in time will be located in any of these stages that we can see here, from the optimum health, okay, to have freedom from disease, but may be exposed to certain etiologic factors, infectious agents, for example, or stress, or may have some risk factors that make individuals susceptible to diseases, to then develop some signs of a disease, then develop some symptoms of a disease. Notice that the signs appear before the symptoms. Maybe the person is symptom-free, but they may have, for example, some findings in the blood tests like anemia or low levels of leukocytes or the presence of certain antibodies. Okay, now, after they develop the disease, signs and symptoms, they may get back to be free of disease and back to optimum health, or may develop a chronic disease or may develop a disability, or they may die from that disease, okay, without developing the disability. Someone has a myocardial infarction and they die without developing any disability. So people may be at different points in their life in this continuum, okay, that goes from the total optimum health to death. Okay, this is the way that we should see, okay, health and disease, not as someone is healthy or non-healthy, like we usually do. So, continuing talking about this health and disease, I want to clarify and give you some important concepts that we need to manage as medical providers. Okay, we have to have clear what is the definition of disease, illness, and sickness, that we sometimes use interchangeably as synonyms. Okay, when we are working in medicine, we need to understand that we have to be clear. Okay, we have to use the proper language to communicate with each other. So a disease is what we normally see in the medical practice. Okay, it's a medically definable condition, something that we study, appears in textbooks. Okay, has some specific signs and symptoms. Okay, belongs into some syndromes, has specific diagnostic tests, treatments, okay, protocols to follow up and to manage the patients. Now, an illness is something that is subjective, it's the feeling of the patient. Okay, and the same disease may be felt differently by different patients. Someone may have a tension headache because of stress, because of reading too much, because of working too much, because of lack of sleep, and they may feel like totally fine with that. And some other people may feel very bad, okay, maybe even feel very sad and about having that headache. Okay, the same with, for example, skin cancer. Some people may not give any importance because they know that skin cancers, some types, are not very aggressive, and they simply, oh, I have to go to the dermatologist, let me get an appointment. Some other people may get very scared and react or overreact to this skin cancer. So that is the illness, the more subjective appreciation or interpretation that we do on the disease. Now, sickness is different. Sickness has more social implications. Sickness is a socially constructed term that includes the societal, cultural aspects of being unwell, okay, and involves different social roles, expectations. People who have a disease are treated differently depending on what disease they have. We may get a medical leave because of having a disease, or we may receive accommodations because of having a disease, or we may be rejected by people because of having certain diseases. Okay, because sometimes we tend to blame the patient for acquiring certain diseases. For example, in the case of obesity, we sometimes blame the patients because we say they eat too much, they should exercise more, and patients feel this rejection, sometimes discrimination. The same with sexually transmitted infections, mental illness, drug addictions, alcoholism. We tend to blame the patient because of having those problems. In the case of other conditions, we tend to be very empathetic with the patients. Okay, when they have, for example, diseases that we don't consider the patient is to blame. Let's say someone has a tumor, someone has a condition that is unavoidable in certain sense. We tend to be more empathetic and accept more and help more those patients than the ones that we consider are to blame for having a disease. Now, one important thing that is important to have clear when we study medicine is the concepts of normal and abnormal. Okay, we use a lot the word normal. Okay, normal values. Your hemoglobin is normal. Your liver enzymes are normal. This patient is normal. Okay, that patient is not normal. And these are terms that we have to be very careful when we use them. Okay, when we say normal in medicine, we are not talking about something that means simply good or absence of disease. And when we say abnormal, we don't imply that there is a disease or there is a problem. Okay, we are simply comparing the findings on a patient with the findings in the average population of their age, ethnicity, race, okay, origin. Okay, this term normal, okay, is something that is based on statistical data. Okay, if you have studied statistics, you know what is the Bell's gauge, okay, the normal curve. Okay, here we have, for example, a population. Let's say we study 1 million people, and we study their cholesterol levels. Okay, most of them are gonna be here. Okay, notice that 68% of the population are going to have the cholesterol levels, let's say, between maybe 200 and 100, just to say something. Okay, now we have the rest of the population, 95%, is 68, plus people who have a very low and a very high cholesterol. So in total, 95% of the population within these values. Maybe this is 50 and this is 250. And then we have the other 5% that will have a cholesterol above 250 or below 50. Okay, that is what we mean. Okay, saying that someone has the cholesterol, let's say we accept as normal the cholesterol between 100 and 200. Okay, if someone has the cholesterol in 210, even though it is above the normal value, we describe it as abnormal, above the normal value. We don't imply that this patient has a disease. Okay, we have to, for example, if this is the first time that we detect this value in a patient, we have to make sure that they are fasting, and we need maybe to repeat the cholesterol levels in order to make sure that they have something that we need to address. Okay, so normal values vary a lot, and normal values also depend on in which population the study was made. For example, there is very little we know about myocardial infarctions in women, because most studies about myocardial infarctions have been done in men. So when a woman goes to the ER with symptoms that look like GERD, acid reflux, or indigestion, or some nausea, we sometimes tend to dismiss these symptoms as stress or as maybe something you ate. And that's the reason why we miss so many myocardial infarctions in women, okay, and not in men, because this elephant sitting on the chest, this crushing pressure on the chest that radiates to the left arm, this is more typical of myocardial infarctions in men, not so typical in women. So we have to be aware of all that. Now, let's continue our travel here. Okay, we have to talk about some aspects, some concepts that have to do with epidemiology. Okay, some terms that are important to have clear before engaging in this study of pathophysiology. Epidemiology means or comes from Greek words, the roots epi, that means upon, above, and demos, that means people, as in democracy, and logi, or logia, that is study. Okay, so it's the study of something that is influencing people, if you take the etymological aspects of the word. But the definition is simply the study of how diseases distribute in populations, the determinants of the health and disease in specific populations, okay, and how we apply the results of these studies to different health problems and to prevent diseases. Okay, something that goes a bit beyond the objectives of pathophysiology, but we need to understand in order to see the diseases in context, okay, not just in their biological aspects of disease. There are some terms that are important that students know very well. Public health is simply the effort of using the scientific findings of epidemiology to prevent disease and promote health. There are some diseases that are considered endemic, which occur at a constant rate in specific places, populations. Epidemic is when the diseases, the incidence of a disease goes above the normal or the usual rates of the disease in that population, in that place, in that season. A pandemic is when the disease spreads across several continents, countries. Okay, we had the example of the COVID, so everybody is aware of what a pandemic is. Then we have the terms mortality and morbidity. Morbidity is everything that is related or caused by a disease or disability, or mortality has to do with death that is caused by a specific disease. There are diseases that appear sporadically, okay, occur in a place. For example, there is a food poisoning maybe once, affected certain people, and this never happened again. It's a sporadic thing that happens. It doesn't regularly happen as the flu epidemic that we may have every year. And also, we need to understand the concepts of incidence and prevalence. Okay, the incidence is the number of new cases of a disease. Okay, when you count all the population that is at risk of or is exposed to certain factor, and you count the number of new cases in a specific period, can be a year, can be a month. And then we have the prevalence, which is the number of current cases plus, okay, the new cases, okay, in a specific population, country, city, and a specific point in time, a week, month, or a year. Okay, those are concepts that we need to understand very well. And also, we have to mention a concept sometimes students confuse, and it's a risk factor that can be confused with precipitating factor. Okay, a risk factor is any personal aspect like genetic predisposition or behavioral or lifestyle or exposure, okay, to certain agents that may produce disease. Okay, and these risk factors are determined based on epidemiological studies, epidemiological evidence. Okay, and these risk factors are associated with a higher susceptibility or a higher risk of developing a disease. Now, a precipitating factor, something that we shouldn't confuse with the risk factor, is a trigger, is a clinical event, okay, that provokes something health-related. Okay, for example, tobacco smoking is a risk factor for cardiovascular disease. People who smoke are at a higher risk of developing coronary artery disease. Now, when someone has a myocardial infarction, it's not because they smoke. It's because, for example, they had an emotional upset, or because they took a medication, or, for example, a drug of abuse, cocaine or amphetamines or something that triggered the myocardial infarction, or performed strenuous exercise and that triggered the myocardial infarction. So, tobacco smoking, sedentary lifestyle, unhealthy diets are risk factors for cardiovascular disease, but what triggered the event, the myocardial infarction, is the precipitating factor. Now, something that we need to understand about diseases is, or are, the social determinants of health, or the different, not only the socials, the different determinants of health. Okay, when we study diseases, we need to understand that diseases don't distribute randomly in populations. Okay, people don't get the diseases just because they won the bad lottery. Okay, there are some determinants that we can divide in social, physical, healthcare determinants, genetic, behavioral, biological. For example, there are geographic factors, Okay, social determinants of health are causal factors that are in the environment in which people are born, grow, develop, like income, education, occupation, social class, social support. Okay, there are some factors in the physical environment, the water quality, if they're exposed to different toxicants, lead, the design of the neighborhood, if their neighborhood is safe or not. There are some healthcare determinants. Okay, for example, if they have insurance, if they have access to healthcare, if they have any ways of going to the actual hospital or clinic, if they know how to take the medications, if they have someone who explains them how to do their treatment. And then there are also some genetic determinants, okay, what we inherit from our parents, some behavioral determinants, okay, how we respond to health education, how we eat, how we comply with the treatment, if we smoke or we don't smoke. But all these determinants of health have to influence or will influence health and disease through a biological determinant. It's a biological mediator. Okay? For example, strength of the immune system, how the endocrine system is working, okay, how the nervous system is working, okay, the age of the person that makes them more or less susceptible to develop disease or complications of that disease. Okay, always there will be a biological mediator for all of these other determinants of health be able to change or to influence the health and disease status in a person. Now let's move to the concept of etiology. Okay, we are going to be comparing the concepts of etiology and pathogenesis, which are two basic concepts that typically appear in exams. Okay, we can give you a vignette and tell you later which is the etiology or which is the pathogenesis of this disease. Etiology is a word that means cause, study of the cause, trying to investigate the cause for a disease or for a phenomenon. Okay, it's like Genesis. The book of Genesis in the Bible is the book of etiology, how things became to exist, different things. Okay, comes from the Greek word atia, which is a cause, and logia, which is a study. Okay, and is the process of trying to identify the causal factors of a disease. Okay, these causal factors or causative factors or etiological agents or factors may be infectious, maybe genetic, maybe environmental, lifestyle. Okay, sometimes the causes are unknown, so we call them idiopathic. And there are conditions that are produced by medical treatment, and we call them iatrogenic. Now, many diseases, many conditions don't have a single causative factor, don't have a single etiology. So we say they are multifactorial. There has to be a combination of different causative factors acting together in order for the disease to appear. Okay, then we can continue dividing these factors in more deeply, but we are not going to enter into more complications here. Now, pathogenesis is a process. It's the study of the sequence of events that occur from the exposure or even before the exposure, and the patient is simply susceptible or at risk, until they develop the disease and they develop different complications or they simply recover. A sequence of physiological events in response to different causative agents. What causes a disease is the why about disease. Pathogenesis, on the other hand, is, or etiology is the why, and pathogenesis is the how the disease develops and manifests. Okay, there are different steps in the pathogenesis of a disease. Okay, we have what happens immediately after people are exposed to the etiological factor, that is the initiation of a disease. Okay, then we are going to develop this a little bit more. Then we have the progression. Here we have a cascade of events leading to the development of the signs and symptoms. Then we have the manifestation of a disease itself, in which we can recognize the specific signs and symptoms. And then we have the outcome, which can be total recovery, or can be chronicity, or can be the development of sequela, disabilities, or simply death. Now, going deeper into this pathogenesis, okay, we have to mention that even before the disease or the people are exposed, as we said here, even before the initiation, there are some factors that have to do with the pathophysiology that we need to understand. Okay, we need to understand that there is a pre-pathogenesis period in which people are susceptible. Okay, individuals are at risk because of their genetic factors or exposures or behavior, smoking, drinking, alcohol, using drugs, etc. Then we have the pathogenesis stage, in which we have the exposure, people get in contact with the etiologic agent, can be a virus, can be simply poison, can be lead, many different etiologic agents. In the case of infectious diseases, okay, we have an incubation period in which the agent multiplies, starts making effects in the body without the presence of signs and symptoms. Okay. Then we have a prodromal period in which people start feeling bad. They have mild symptoms that are not specific. They simply feel tired, sleepy, drowsy. Okay, I'm getting something. I think I'm incubating something. Okay, all that is the pathogenesis stage. Then we have the specific stage of disease that can be acute, when the disease starts with the signs and symptoms that we recognize and we can use to diagnose the disease. Okay, these symptoms will reach the greatest severity in what we call the peak of the disease, and then the symptoms start to abate, to decline, in the period of decline of the symptomatology. And then people may develop the stage of convalescence when they start to recover. Now, post-disease stage has also some possibilities. Some people may develop sequelae, like paralysis, permanent change, or a murmur, or a valvular disease after rheumatic fever. It's a permanent effect of the disease. Or they may develop complications which are unrelated. This is another disease that is unrelated to the initial or original disease. For example, someone may have the flu, and they may develop, as a complication, a bacterial pneumonia after the flu. That is a complication. Or people may have a complete recovery, that is resolution, or they may develop a chronic disease. Okay, that people need sometimes permanent or long-term management of the disease. All this is important, okay, to understand how to act in any case. Okay, we try to avoid, okay, we do preventive management to try to avoid that they move from the susceptibility or pre-pathogenesis to the pathogenesis. Once they are exposed, we could do something to prevent the development of the disease. For example, post-exposure prophylaxis after getting a needle stick with someone's blood and the patient has HIV or other virus. Okay, once they develop the disease, we try to stop the disease from getting worse, to avoid that they get to the peak. And once they are in this clinical disease stage, we try to prevent sequelae, complications. We try to prevent the disease from becoming chronic. We try to take everyone to the resolution phase, but sometimes it's impossible. Okay, but that's our work, trying to prevent the movement or the worsening or the development of permanent changes, death, or complications. Now, talking about the clinical manifestations of a disease, it's important to know the difference between a sign and a symptom. Okay, signs are objective manifestations. Okay, there are things that we can observe and measure. Okay, it's data that may be gathered by physical examination or simply doing blood tests, x-rays, different diagnostic tests. Okay, a symptom is a subjective feeling that patients describe we don't see. Okay, for example, someone may experience nausea or vertigo. We don't see that. They tell us. Okay, when we observe, for example, vomiting or we measure fever, that is a sign. Okay, the case of pain. Okay, pain is a symptom, okay, that we hear from the patient. Now, when we do the physical examination, we may determine objectively that the patient has tenderness in certain parts of the body. That would be a sign. Now, also, we have to understand what is a syndrome. Syndrome is a group of signs and symptoms that are well classified, that typically are associated with several diseases. Okay, someone may have, for example, metabolic syndrome, or someone may have a Cushing syndrome. Cushing syndrome may be as a result of different diseases, for example, a pituitary tumor, or an adrenal gland tumor, or simply because patients take medications, patients take corticosteroids, okay, and that, or those three causes and some other causes may produce Cushing syndrome. And we also have to mention something about the stages, okay, of disease, okay, that we have to mention, and that we couldn't cover in this part here. Okay, I didn't want to put too much information here, but I need to give you, okay, some other terms. Because, for example, in the case of, most of this applies to many diseases, but mainly infectious diseases. But we have many different types of diseases. But for example, in autoimmune diseases, people may have a course or a natural history of a disease that follows different stages of exacerbation, getting worse, and remission, getting better. Okay, so it's like worse, better, worse, better, worse, better. Okay, and exacerbation is simply a sudden increase in the severity, getting worse. And a remission is a decline, okay, of the signs and symptoms. They are not so severe. Sometimes the remissions may be permanent. Okay, when someone has a remission for more than 5 years, we say they are cured of the disease. Okay, that doesn't mean that they are never again going to develop symptoms, but we can say they are cured if they stay symptom-free during 5 years or more. So one of our main tasks is to develop a differential diagnosis. Okay, in pathophysiology, we don't teach you how to make a differential diagnosis. That is something that is more for clinical medicine. But this is going to be your everyday job. Okay, you get a patient with a complaint, you interview the patient, you make some tests, you start thinking, okay, this problem may be this or this or this, and then you do tests to rule in different conditions. Okay, you have normally a set of possible competing diagnoses, and once you study deeper the patient, you start working with a single diagnosis. Okay, and here you have some videos that I recommend you to watch carefully. They are very good videos that teach you the basis of how to make a differential diagnosis. Now, when you develop a differential diagnosis, okay, you always need to have some guide. Okay, and this is a mnemonic that we can use, okay, to not forget different causes of disease. For example, someone has chest pain. You have to rule out different potential causes of chest pain. Vascular, myocardial infarction, inflammatory, pericarditis, neoplastic, any tumor that is affecting the thorax, degenerative or deficiency. There are conditions, okay, some nutritional deficiencies or some diseases that occur as a result of age, okay, that, for example, may lead to problems in the aorta or in the heart, okay, intoxications, iatrogenic causes that may cause chest pain, congenital malformations, autoimmune diseases like lupus or allergic reactions, trauma to the chest or different traumas, and also endocrine metabolic problems Hyperthyroidism, for example, that produces tachycardia may lead to chest pain. Okay, so this is a mnemonic that is very useful and can be used for any symptom, any sign. Okay, so we don't forget. There is also an anatomical approach. You go from the skin, the bones, the ligaments, the muscles, heart, the lungs, trachea. Okay, so you don't forget anything that is in that area in which the patient is developing the pain. And finally, we are gonna talk about the treatment and health maintenance implications. This is something that is to be developed in more detail during the course. Okay, if we understand the pathogenesis, etiology, we are able to understand better diseases and study diseases better and decide what is the best treatment for the patient. Okay, let's say you have a patient with hypotension. Hypotension may have many different causes, maybe due to septic shock or cardiogenic shock. Okay, and the treatment of these types of shock is different. Okay, in the case of septic shock, of course, we have to give antibiotics, but we have to give vasopressors to produce vasoconstriction and give fluids to this patient. But if the patient has a cardiogenic shock, that means they have a fluid overload, their lungs are congested, pulmonary edema, we don't give fluids to these patients. Okay, we give more diuretics in order to relieve the congestion that they have in the lungs. Okay, so pathophysiology is going to be useful to make general statements, not for specific prescriptions. That is the task of clinical medicine. And finally, here we have the implications of pathophysiology for health maintenance. Okay, pathophysiology will help you develop your skills for disease prevention, lifestyle modification, pharmacological interventions, monitoring, following up patients, for deciding immunizations in different patients, for deciding mental health strategies, and to understand the health disparities so you can perform targeted interventions and work with cultural sensitivity, and also has many other implications for public policy, allocation of resources, legislation, etc. This goes a bit beyond our scope, but it's important to understand, how you will use what you learn in pathophysiology in the future. Thank you for watching.